The SecurAcath trial was a randomised control trial that we undertook in 2 large tertiary hospitals in Australia. It was powered so that we could show a clinical difference in the reduction of dislodgement for non-cuffed central venous catheters. So that included PICCs inserted in the upper limbs, generally in children and neonates, and also tunnelled non-cuffed CVCs that are inserted in the neck, and they usually end on the chest wall. So we found that the subcutaneous anchor securement system significantly reduced dislodgement when both devices were anchored with the subcutaneous anchor securement system. We found such a massive improvement in the device dwell and reduction of complications. So now we really need to get it out into the hospitals so that all the children can benefit from it. We undertook the trial in the population that we thought was the most vulnerable, but these same outcomes can be translated into an adult population, those adults who are elderly and have complex care needs, because we really need to look after their veins as well. So you have elderly people have far more comorbidities than what children do. So you have adults who have a cancer diagnosis or a renal diagnosis that can really benefit from one device lasting for the duration of their treatment. From a cost perspective, we did look at that within our analysis as well, and we found that when you put into account all the other factors that are required to treat the increased complications when you aren't using the SecurAcath, the cost of implementing this device was actually cheaper than treating all those complications from failure. Other questions that we've been asked is, during its dwell time, is the actual subcutaneous anchor securement system painful for the patient? I would say ask the patient. We have asked the patients, and the actual dwell was not an increase in pain for them. Knowing that they have a catheter that's going to last for the duration of their treatment is a big plus for them. So that's a ease of mind, a peace of mind for them, knowing that this securement product is going to last for the life of the line, that you don't need to have a new securement product changed at every dressing change. And doing a dressing change and holding down a child is quite barbaric. So if we can insert this device in a way that is free of pain on insertion, then the actual dwell time is going to be a lot smoother for both the patient, the clinician, the family. Everything's going to be a better experience for everyone involved.